To kick off the session, hi everyone, I'm Jessica Roberto. If you haven't met me before, I am an associate director at the Buerk Center for Entrepreneurship, responsible for the Hollomon Health Innovation Challenge, which is why you're all here today. I'm a UW alumni myself with a background in health innovation, and it's always my great pleasure to see all the cool ideas that all of you come up with every year. But today we are here to talk about the Hollomon Health Innovation Challenge. This is our annual health competition here at the Buerk Center for Entrepreneurship for anything involving human health and wellness. So medical devices, therapeutics, digital health, all of it under the sun. Really, it is an opportunity for students to showcase, your idea to improve healthcare as we know it here. The sky's the limit for really anything that you can do. And the time to do healthcare, of course, is now. We are seeing massive changes in our current health and research environment here in the US, but what is, can be seen as a challenge can also be an opportunity. There's been a desire for new approaches to healthcare for a number of years, ever since the COVID era. And there's been a lot of new enabling technologies from mRNA therapies to AI, generative AI, machine learning that is really changing the way healthcare is being delivered. And Seattle and the Pacific Northwest are really an innovation hub in these areas. The UW itself is now ranked in the top 5 for both undergraduate and graduate programs in entrepreneurship. So really there's no better place to be to innovate in healthcare right now than in Seattle and in the Northwest. As I mentioned before, our projects for the Hollomon Health Innovation Challenge encompass anything working to improve human health and wellness, whether that is a physical product, a new process, or by way of delivering healthcare, a service, anything that's a new approach to care and treatment, wellness, or safety and access. And it's also open to a wide number of students' eligibility across the region. Really, any undergraduate or graduate student in good standing at a degree-seeking program, part-time or full-time, in Oregon, Washington, Idaho, British Columbia, or Alaska. So we very much encourage students to form teams across schools. If you have friends at other schools in the region, please invite them to join teams. It's very fun to see other folks come in because ideas come from wherever, not just here at Maine UW campus and not just in Washington in our region. I do want to highlight a little bit what we mean by student. We've had some questions about eligibility, particularly around recent alumni. So I'm just going to run through real quick our definitions of students and what we mean by team member. To us, a team member is a currently enrolled student who has a leadership role in the team, an ownership stake in the idea, and has the potential for either equity or employment in any sort of future company that may come out of the idea. Our student team members are responsible for all of the deliverables for the challenge, whether that's the initial 5 to 7 page business summary we'll discuss in a little bit, or if you move forward to the final round, that would be the final round judge pitch, as well as any judge engagement during that final round. A non-student team member, we do allow in the competition. This would be anyone who is a recent alumni. Say you are a senior, you just graduated in spring 2025, but your friends are still working on the project, friends or other individuals involved in the day-to-day decision-making about the project. You also have perhaps a stake in the project and you're interested in participating. Very much importantly, non-student team members are not allowed to pitch or initiate discussion with judges at the final booth. You may attend as kind of a secondary support role. Maybe you are an expert in the technology. So if a judge has very complicated or detailed technical questions, you can be there to assist. But we do ask that these currently enrolled students take the lead on any interaction with judges during the competition. Finally, we have team advisors. These are your non-student mentors, faculty members, or anyone else who is an advisor to your project. They don't play a role in day-to-day decision-making. They're not really involved in how the project is progressing moment to moment. And just like non-student team members, they cannot pitch or initiate discussion with judges at the booth, but they may attend the reception portion of the final round to cheer you on and watch the judging. So what does that actually mean? What happens at the challenge? What does that look like? So the challenge itself, there's 2 rounds. The first is the screening round. We'll talk about that is an application that we are accepting right now that's due on February 2nd. that, we'll go into detail in a little bit. From that initial application, we select 20 to 22 teams to move forward to our final round, which is pictured here on the slide. It is a trade show competition. So all of the teams get to give up. You give a 60-second pitch. You'll have a booth, like a 6-foot by 6-foot booth that you get to show off in a marketing style, show off the prototype that you've been building, and interact with judges face to face. Those judges are from the community around us. They are entrepreneurs themselves. They are health experts. They're physicians and investors and lawyers and regulatory folks and insurance folks and anyone who really has a sense of what it takes to bring healthcare ideas to market. You know, every piece of that elephant is represented in the room, that they know what it's going to be like, and they can really give you expert feedback on the road ahead. And most importantly, they're the ones who decide who wins. So we award a variety of prizes at the HIC. Most notably, our grand prize is a $15,000 grand prize, which this year is sponsored once again by the Hollomon family. Our $10,000 second place prize is sponsored by WRF Capital, and our $5,000 third place prize is sponsored by Fenwick. All of our prizes are completely non-dilutive. That means we just write you a check. We don't take any sort of ownership or stake in your idea. We're really here to help you launch and grow as the talented innovators that you are. In addition to our top prizes, we also offer a number of what we call best idea prizes. These are rewards for innovation in specific categories of healthcare. This year's prizes, there may still be changes leading up to the competition. So please check on our website in a few weeks for kind of the final list. But the ones we have right now, we have the Best Idea in Digital Health Prize, sponsored by the Mindful Therapy Group. This recognizes an innovative digital health application that has a high likelihood of being implemented in practical situations and is expected to have meaningful impact. We also have the Best Idea for a Medical Device from Matricure this year, which recognizes a medical device concept, so a physical product that will have a promising opportunity to significantly improve patient lives. And finally, we have the Best Idea for Addressing Health Access and Disparities Prize, which recognizes an innovation that seeks to close the gap in health disparities for low income, for disadvantaged groups, or increasing access to health services, either due to location or through some systematic biases within the system. Importantly about the Best Idea prizes, you can win one of the Best Idea prizes as well as one of the top 3 prizes, but you cannot win more than one Best Idea prize in a competition. So key dates for this year, if you've already found our website, you should know these ahead of time, but just to iterate them here, the application is open now, so you can go to the UNoodle website. I will drop in the link in the chat once I'm done with my presentation. And the deadline to enter is February 2nd. That's a Monday at noon. It's not midnight, it's noon. And that application will go out to our judges for that initial screening round on February 4th. The screening round lasts about a week. So we expect to let our finalist teams be notified on February 12th. From there are a couple of post notification events that happen before the final round on March 4th that will let those teams know. There's a pitch clinic, resource nights, things like that. But for right now, these are the key dates to keep in mind and mark on your calendar for the rounds of the competition. So talking about deliverables, as we have for that initial application, the one that's due on February 2nd, we have our 5 to 7 page business summary. This is really what the judges will use to evaluate your idea. There are definitely samples on our website, as well as kind of physical samples we have in the office, if anyone here happens to be on UW campus. And this is your introduction to your idea. We're not really looking for a true business plan, as you might expect for the Dempsey Startup Competition later this year. We really are looking for problem, solution, fit, impact, and the commercialization go-to-market plan ahead of you. For the final round, for those of you who progress to that event, we switch it up a little bit with a 1-page business summary. This really is designed to be a condensed version of your 5 to 7 pager to act as marketing copy. We provide this to the judges ahead of time of the final event, so they get to know who's going to be there. We also expect your preparation of a 1-minute pitch, as I mentioned, and then the booth and prototype demo as seen in the pictures here. But today, since we're going to be talking about the initial application and the screening round, I wanted to share some of the criteria the judges will look for in the screening round, as well as some tips and tricks to help you put the best spin on your application. So what do the judges look for? The first is, the definition of the problem. Who cares about this problem? What will be different if you solve it? What is the size of the problem? I will note that, this is not necessarily market size. Is what is the scope? How many people are impacted by this problem right now? It is not necessarily true that the larger the problem you have, the more likely you will to get through. We really are looking for how well do you address the problem, not necessarily how big that market size is. They also are asked to look at your proposed solution and your demo. What is your idea for solving the problem? Is it a unique idea that hasn't been done before? Are you able to build it? What you are proposing. Again, the market opportunity, that's how many people need the solution. How many would actually use it if everyone affected by this problem? How would this get out into the world? Would you sell it directly to hospital systems? Would you go directly to patients? Kind of looking through what that market would look like. Who your team and advisors are, who do you have with you? Do they have the skills to solve the problem? Or do you have outside advisors, as we mentioned, mentors, or do you know who you need to recruit to your team still to fill in those gaps? And finally, we want to look at the impact. What health impact is your idea going to have if it comes out into the market? So finally, this is kind of the rundown. So it's what's your problem? What is your solution? How will you build and validate it? Who's going to pay for it ultimately? And what impact is it going to have? These are the 5 questions that the judges are really tasked with evaluating your business summaries with. And you'll find all of these on our website as well. If you go looking for the business summaries, these criteria are in the same location. So now that we know the criteria, I want to share some of the tips and tricks I've seen benefit teams over the years that I've been doing this. So the first one is early is expected. This, as I mentioned, is not a business plan competition. It's a prototyping challenge. So we are not expecting clinic ready MVPs. We're not expecting, market traction and, super growth here. We're really looking at problem solution fit. It's always great when you have validation data, but I've also seen teams presenting with wireframe mock-ups on a poster, and I've seen teams presenting with prototypes that are paper and string and straws. So it is not necessarily it's not necessarily going to hinder you if you're really, really early, as long as you have a clear vision of what you're going to build and that you know how to build and test it. 2, the compelling care case is critical. As I said, this is a health innovation challenge, so showing that your idea has a health impact is going to be key. We do, that's a broad definition. But we do have people who are more, some people might be an environmental health solution, you have an overlap, or you're definitely a digital social tool. You always have to emphasize the health impact, even if you have other benefits, such as, an environmental benefit. If you're capturing greenhouse gases, you're dealing with pollution. That's a great thing to emphasize in your environmental innovation challenge application. But here you want to emphasize that health benefit. Proofread prolifically. Have people who aren't writing it read it over. Look for the extra periods, the misspelled words, the missing words. It really, can jump out to a judge when things like that are present. And even if they're trying to read past it, it can sometimes impact how they view your application. Just comes across as less polished. So please proofread your applications. I find that reading them backwards can actually help with that, because your mind doesn't insert words that aren't there. Number 4 is forget fudging. As I mentioned, all our judges are experts in their fields. They know this area very, very well, and you'll probably get questions that you don't know the answer to during the final round, sometimes in your feedback. And don't make up answers. Don't guess at answers. If you're unsure of something, it's okay to admit that you don't know the answer. And that's when you ask for, hey, can I follow up with this judge to understand more? I'd love to get your card. Let me get back to you. And finally, don't delay. It is very tempting. I know with the deadline, I'm the same way, that I will be working on it right up to the deadline and try to just scoot it in at the end, but it is much less stressful if you work on it earlier, get all your ducks in a row, including figuring out who your team members are, and getting close and getting all your things together for the application way before noon on February 2nd. I do see I have something in the chat. Could you please tell me where I can find sample applications? Yes, so on the HIC website, hic.uw.edu, again, I'll link that after my presentation, under the preparation section, there is a whole list of sample applications. One other point I wanted to mention on the don't delay aspect, it is very important to get your team members all sorted out ahead of time. As part of your submitting your entry, the designated team lead who has opened your application has to invite other team members to complete their profiles for the application on our Unito platform. All these profiles must be completed and submitted before the full application can be submitted. So you don't want to be trying to call your team members in class on Monday, the 2nd, being, fill out your profile, you haven't done it yet. So we really recommend inviting your team members, to start the application, just get those invites out, have them finish their profile as early as possible. You can upload everything else to the application later, edit the application at any point up into the deadline. But we find that's the most frustrating part for people at the very last minute. So please get that done ahead of time. I see another question in the chat. My startup is an education platform for medical students. Can I enter the competition? It's not for the patient, but improving quality medical professionals. Absolutely. Anything that improves patient human health and wellness, and if that improves medical care, that does lend itself to the competition. Finally, I do want to just put forth our ChatGPT recommendations. A lot of people, it is everywhere. People use it to write and help with their research. We just ask that you keep some guidelines in mind if you choose to use generative AI to help you prepare your application. The number one thing I always ask is to double check references. Any market data, scientific data that ChatGPT gives you, please double check with another source, particularly if you're trying for things that are very recent. Likewise, beware of putting any proprietary data, especially patient data, into any open source models. For this reason, we recommend using UW's instance of Copilot or the new Purple Gen model if you have access to it, just to keep all the data behind a firewall. Similarly, AI-generated work is not patentable or copyrightable, so be aware of using it to create logos and things like that. And I think for me, I really, ChatGPT is great at analysis and feedback, but can't replace your voice and your thoughts regarding your idea. I don't want to hear what Gen AI, Claude, or ChatGPT thinks about your idea. I want to hear what you think about your idea, and so do the judges. So just keep that in mind. If you want to use it to draft, that's one thing, but make sure your voice comes through. And finally, we ask that you acknowledge work done by AI like you would any other team member, a footnote in references like that. And you can go to our website again to see a more detailed version of these recommendations. Some other resources too, particularly for those of you who aren't local, here's some things that you could use. I have virtual office hours every single week. So if you have specific questions about your eligibility or your team or something you want, maybe not to share in a large group setting, feel free to sign up for my office hours. I also have a larger collection of more recent examples of past entries, ones that we're not comfortable putting on the internet yet, because a lot of them are still pursuing commercialization, that you can come see by appointments at the Buerk Center offices. The Buerk Center also has a resource lab on our website, which has a list of curated resources for understanding, say, finance or backgrounds in, angel investing or pulling together, legal or IP resources. So if you're looking for some self-taught things, that's a great set of resources to rely on. There's a UW Makerspaces for anyone local who are looking to get some, I need a place to do my prototyping, I need a 3D printer, things like that. I look them up. And for anyone not at UW, I'd look for similar spaces on your campus and see what availability student resources you have. And then Startup Tree, where you registered for this event, has a number of all of our events for the Buerk Center. A lot of them are good for team building, even if they're not specifically designed for that. And we also have our virtual team formation pages, which is where you can post what you're working on if you're looking to broaden your reach of potential team members who aren't coming to physical events, as well as look at other projects that are currently available and other people who are looking to join. But wait, there's more. So that's everything about the HIC, and we'll certainly turn the floor over to you in a few minutes. But I wanted to, of course, highlight the other competitions that are happening this year. The Health Innovation Challenge is just the first of what we call competition season. So the next challenge coming up would be the Environmental Innovation Challenge. So anyone, again, working on an environmental health innovation or project would be absolutely encouraged to enter that as well. The deadline to enter there is February 9th. And then a little later during spring quarter, we have the Dempsey Startup Competition, which is our true business plan competition. A lot of folks who go through the HIC or even the EIC tend to do much better in the Dempsey because you've had that whole first round of feedback and then you're ready to keep going and learn even more. The Dempsey is it's a longer process. It's a 5-round competition instead of a 2, but that just means the rewards are higher. The top prize of the Dempsey Startup Competition is $25,000. So once again, here are the key dates for the Health Innovation Challenge. The deadline to enter again is February 2nd at noon, with finalist teams being notified on February 12th. That just happens to be my birthday, so I'm going to be giving all of you a present. And with that, I'm happy to take any questions. I'll go actually back and put that those dates up on the slides so you can look at them, but I will be sending out the slides and the recording after the session is over. Okay, so I do see one more question in the chat. What about the model is freemium or a nonprofit of the innovation that you're thinking of? That's fine. Now, the business model itself, it doesn't have to be for profit to compete in the competition. You just have to be able to show how the model you have chosen is able to produce revenue that would allow you to grow and be sustainable in the future, whether that's for-profit, nonprofit, a freemium conversion model. You just have to be able to show that you're sustainable and can grow. What are the formatting guidelines for the business summary? Oh, that's a great question. We don't have a specified format because the ideas are so different that trying to pigeonhole all of them into a single format, we found actually doesn't work very well. But that's why we provide the examples so you can see kind of how other people have done it. I always say that pictures are very much wanted, and that's the one tip I have is do include pictures and diagrams and charts. The summaries that are kind of just all text are not as easy to digest as ones that paint a picture by literally showing a picture. I think that's the one suggestion I do have, but there isn't a prescribed format. It really is show it off, show your idea best way that works for you. The one thing the second thing I'm going to say not to do is submit us a PowerPoint deck. People have just submitted slides before, and that doesn't work because you can't get as much information off slides without a presentation as you can out of a summary. So no PowerPoint presentation decks, but do write out and use pictures and illustrate what you're trying to build.
So in terms of the prototype itself, as part of the HIC submissions, I mean, you mentioned that it could be quite, it could be quite early and could be quite rudimentary. How far, sort of, what does that look like, right? Does it have to be something that is showable and it functions? Say, if I were to build some sort of platform, it should show some sort of dashboard that works. Some numbers could be entered and out. It can output certain reports. To what degree does the sort of the initial demonstration need to be? What caliber does it need to be at?
Yeah, I think it really has to demonstrate what you're trying to do. Anything that, being able to enter things or show what screens would like under certain circumstances. Certainly anything that you can vibe code with Lovable, that isn't production ready. You would never launch it to the web, but that you can show interaction. You can show, oh, hey, if I enter my information, it pops up the map of all my data providers, for instance. That type of thing is what we're really looking for. It's just a demonstration of the concept that if you were to really invest the time and, I'm going to go buy my own domain and I will, have actually a real software engineer look at this code that I wrote with Lovable and make sure that it's production ready. That if you put the time into making this actually deployable and, beyond just a Lovable demo, that it could fly.
I was wondering, I'm part of an RSO where we have multiple teams participating. So in terms of that, does the application change in any way if you're part of a RSO or an organization, or is it the same?
No, there shouldn't be. I think the one thing to keep in mind is that just team size. So if a lot of people in the RSR are working on a single project, that can kind of complicate how things are done for the challenge. We typically say the best team size for participation is between 3 and 5 people, just in terms of being able to be in the booth and who's in charge of what. But as far as if you have multiple projects and multiple people wanting to submit, that's totally fine. You just have to be aware of that if one person is on multiple teams, if multiple projects that you're on get forward to the final round, you have to pick. You can't be at multiple booths. Well, if there are no other questions, I'll go ahead and wrap up this session. So thank you all for joining us.